Why are you handing me this? Yeah, I wanted it 5 minutes ago. It's useless to me now. Throw it away. Why is it my...
Today we have nurse practitioner student Iliana Yi.
Hi, thank you for having me.
Iliana, has anybody ever told you that they keep the operating room very cold to minimize infections?
I've heard that.
Is that true? Stick around to the end to find out.
Good morning, doctor. We have a new med student working with us today. Hi, I'm excited to be here. We're happy to have you. Please be nice. Of course I'll be nice. Like, don't let them scare you. I'm not like the other surgeons, all right? I'm really easygoing.
I've heard that one lots of times.
This is a great video because there are certain personalities that are attracted to surgery, general surgery, and subspecialties of surgery that are very, how should we say, aggressive, maybe can be demanding. They want what they want and they want it 10 minutes ago. And so there's a process of education where you train medical students. Well, not all medical students end up going into surgery, so you might get timid students that it's just a bad match. So Iliana, what's your experience with surgeons or your perception based on your rotations in nursing school?
Intimidating to go into the OR, not to mess up.
What's the blood pressure doing? Okay, make it better, please. Can we check the blood pressure, please? The patient's moving. Why is the patient moving? Like, I only get paid to do my job. Don't expect me to do yours, too.
You tell the anesthesia, they induce anesthesia, patient goes to sleep, and at no time should they move or breathe or have any kind of movement at all. And it's not as if, again, there's just a anesthesia button. I think he's done a video on that where he flips the switch and anesthesia comes on and switches it and the patient wakes up. I mean, it's a complex, constant process of monitoring the patient's vital signs, but certainly there are times when maybe things aren't being followed as closely and the patient does start to move when they shouldn't be, and we'll say, why are you checking stock prices? You should be managing the patient.
Bed up. Bed down. Put the bed exactly where I want it, please. Reverse Trendelenburg. That's regular Trendelenburg. I need reverse Trendelenburg. Dr. Trendelenburg is rolling over in his grave right now. It's way too hot in here. Turn the...
How do I know where you want the bed?
We have a great video on the battle that goes on over Trendelenburg, or the head down position. But the bed position up and down, again, as if the surgeon is this high and mighty individual and thinks of the anesthesiologist as someone that just kind of raises and lowers the bed, and that's like their role in the OR.
Here, turn the temp down, please. It's not as low as it can go. Make it colder. Well, then call HVAC and tell them to make it colder. I'll tell you where the money went. Right into hospital administrators' pockets.
There's like so much to dissect here.
Right.
Did you find that it's really cold in the ORs?
Very.
So historically, they've always said that this lowers the infection rate, right? In fact, that's a total myth. Lowering the temperature has nothing to do with patient safety. Doctors are under layers of gowns and masks and hats, and we're being cooked under the OR lights. And it's very hot, and the room is cool for one reason.
Right,
the doctor doesn't have to be as cold.
surgeon.
Which, I don't know, if someone's operating on me, I want them to be comfortable. How do the nurses feel about that?
The nurses don't like that.
No?
We're the only ones with a blanket around our waist, shivering there.
Hey, where's the music? Let's get some music playing. Oh, turn it up. I love this song. Music's way too loud. I can't hear myself think. Okay, I'll take that instrument I like. I don't know, just hand it to me, please. Yeah, and they just keep hiring more administrators. Why are you handing me this? Yeah, I wanted it 5 minutes ago. It's useless to me now. Throw it away.
Give me what I want, not what I ask for. That never happens. I've definitely had where I've been frustrated, something wasn't there exactly when I wanted it, send somebody to Albuquerque to get it, and then they get it back, and I'm like, yeah, I don't want that. That's useless. Throw it away.
Why isn't my equipment working? Why isn't this working? Okay, find someone to explain to me why this isn't working. Listen, I care about social issues. You'll understand once you start paying taxes. Who are you? Why what doesn't work? I don't even care.
And again, I'm trying to look at that from both sides. So as the surgeon, you're in the case, you're dissecting around vital structures, organs, blood vessels that, if you don't have your full attention, you've literally got someone's life in your hands. And so it can be frustrating when you have equipment that doesn't work.
Anesthesia. Hey, anesthesia. Oh, anesthesia. I drove the BMW in today.
Anesthesia has the name. You gotta learn anesthesia's name. I have had to learn over time because, as I said, you kind of learn to act and be a certain way in training, and then you get out and you learn that collaboration's always better.
Something wrong with the Porsche. I don't know. I had to take it in.
That's why you're going to nurse practitioner school. You want the Porsche.
Right.
Making the big bucks.
Someday.
I don't usually talk about cars in the OR. How do you feel about doctors bragging about their stuff?
You know, I don't really hear anything about cars necessarily, but
She's being too nice.
They're very nice.